Yeah, it seems like there's so many things that there is so much confusion about when you're talking about your aging parents in so many different ways. I think hospice and home health is,
Hmm.
to me, it's so confusing
Hmm.
because I don't really understand the difference in some ways. But
Right.
when do I call in one? When do I call in the other? Could I actually have both?
Absolutely. And so today we're bringing in Jessica Davis from Generations Hospice because we want to try to sort of cut through that confusion because I think that way we can be better advocates for our aging parents. Jessica, thanks so much for being with us.
Well, good morning, and thank you for having me. I think this is a huge topic that even I get confused about a lot. So I think it's good to kind of lay it out, at least in some form,
Mhm.
the differences between home health and hospice and how they can work together in some cases.
Yeah, absolutely. Because I think that when you see your aging parent has a problem, it's hard sometimes to know who can help them
Yeah.
and what can they be helped with. So let's just start with, both hospice and home health come to you generally. There, just in case people have heard, there are some hospice locations where you actually go to hospice, and I think that's really how it started.
Mhm.
But the current model is most of the time they're going to be coming to you. So if correct me if I'm wrong, that's correct, right?
Yeah, so
Okay.
most in all of my individuals, we don't have a location they can go.
Right,
So
right.
instead, we go wherever they are, whether
Right.
that's the memory care, the assisted living, into their homes, wherever they are, we go straight into them.
Hmm. So both home health and hospice will come to you,
Mhm.
but they serve, in many cases, very different purposes.
Correct. And, my team, Generations Hospice of Austin, we do the hospice piece of that. But I think you are right. It's so confusing that I feel like it's good to kind of note that both of those entities, the home health and the hospice, can come to you where you are and serve whatever role you're kind of looking to achieve.
Mhm. Let's start with hospice being clearing up the fact that a lot of people think when somebody goes on hospice, it means that this is the very end, that it is, we've got 10 days, 2 weeks. And I think oftentimes people don't bring in hospice till then because they think that's kind of what the purpose is, but it's really much bigger than that.
It's really a huge misconception, and I think that, when I'm in a senior living community, so I think we all have done a really good job educating until I talk to people on a daily basis and realize it's really not that way. That people think this needs to be the last 3 weeks of our lives for our family member, or we're not doing this. And I can give you a great example. Even my own family, there were 6 children, and my grandmother, it was the last 3 weeks of her life before they brought in hospice care.
Mm.
And it was really sad to see that she could have been helped for a lot longer.
Mm.
She had spinal cancer. So it was really sad even for me to watch that happen for my own family, where I have individuals who they've been on hospice for 3 years and are thriving. They
Mm.
absolutely still qualify and need us, but they also are not on their last 3 weeks of life. They
Mhm.
have a lot of life left and a lot of quality that they can spend with their loved ones still.
Mhm. Mhm.
I think it still confuses a lot of people, especially when you bring home care into the mix.
Home health.
No, home
Oh,
care.
home care.
Because if you've got home care, you've got home health, you've got
Right.
hospice. And my dad's 85. Actually, today's his birthday, and he's doing
Oh, wow.
well. But if things were going bad for him, I'm not exactly sure whom I should call first. Is there a way besides going through the whole diagram of, okay, here's what you do for home or home health or hospice?
Right.
Who do we call for the expert? Who do we call first? Do we rely on the doctor? Do we rely on someone like you? How do we find out who we should talk to?
100% reach out to one of the agencies. So if that's me, great. I will tell you, I probably only take in about 20% of the patients and the families I talk to, because a lot of them just need resources other places.
Mhm.
There are a lot of, even though I don't do home health, there's a lot of home healths I refer to, and
Mhm.
a lot of home cares I refer to as well,
Mhm.
and trust with my the people who and families that call me. And I think just calling someone who has a little bit more knowledge,
Mhm.
it changes every day, and I can't even keep up. So
Mhm.
how am I expecting others to do the same if I can't even?
Mhm.
But at least I know where to start.
Mhm.
And I believe that if you have a good agency or a good person you can call and talk to, they're not going to push you into something that isn't right for your loved one.
Mhm.
The goal is to get them to the right place, not just put them in a program to put them in a program. And I think that's the key, because a lot of people think, or at least I know my family thought, I'm going to throw I'm going to call this hospice rep, and this hospice rep is going to throw them into hospice, and they're not ready. We're not ready for that step. And that's very much not the case. You know, I have a family right now I've been talking to for a year, and we will continue to talk and get them to the right resources until they're ready for me. And if it never happens, then that's okay. I also believe too that it's just like a pair of shoes, that not every agency is going to be right for you, and that you kind of have to find who you trust and who's going to be best served for your family member.
So thinking about the fact that, one, I think the important piece to remember is that you don't have to be actively dying to be on hospice. I think that's really where the misconception comes in. Can you give us some examples of, and I know this is differs, but some examples of, say, when you would need hospice versus when you would need home health? So, for example, how does Alzheimer's play into this? Because that's a common problem for people.
I think that one, and this one's one that you probably will start out with home health. And home health, the goal is to restore some type of function or to bring you back to some type of baseline. And so if they feel that some physical therapy and some skilled nursing and occupational therapy is going to get them back to a baseline of care where they can thrive, then home health is a great option, because you're going to get a skilled nurse. You're going to get, if needed, a physical therapist, an occupational therapist, a speech therapist, an aide to help bathe in limited cases with home health. But they're going to bring them back to a level of a certain base to where they were before. I would give you a better example of that, I think, for me, is if they come out of the hospital and they just had some type of surgery or some type of event like a stroke. Home health may be a good first step to get them back to wherever they're going to be able to be restored to, whatever that looks like moving forward. And then once they've progressed to a point where they're really not showing improvement anymore, I say then that's a time kind of where hospice can take over and fill the gaps to kind of change what we're looking for and what we're trying to achieve. Then we're looking to achieve quality of life, not quantity necessarily, but that doesn't have to be the last few weeks. That can be, a lot longer years, however long that individual lives. And to take them from trying to restore to keep whatever they have as the goal, as their baseline, as a new form of where they're going to be. And that I will tell you, individuals on hospice actually seem to get, and a lot of them seem a lot better because you get a team surrounding you. And the difference there is with home health, you get that limited amount of people coming into your home. So it may be a skilled nurse and a physical therapist. With hospice, you get a whole team. So you're getting a skilled nurse, you're getting someone to help bathe, a social worker, a chaplain. But then the big things like the medical equipment, the medications, and then the big one that I think we don't talk about enough is the incontinence supplies. So Medicare pays for all those for hospice patients, whereas home health, that's not something that they are going to pay for directly.
Gotcha. Okay. So, and that would be like, that was an example of sort of if somebody has advanced Alzheimer's.
Yeah. Correct. So you would start with that piece of the puzzle, which is home health, until they feel like probably they're not going to gain anything more from that home health setting. And then they can be transitioned into the hospice setting, where is going to be more encompassing of a whole team. And that is also, even though we may not be there 24 hours a day, is 24 hours a day. So if you need a nurse in the middle of the night, you can have them come, whereas home health, that's not really part of that model for home health.
And that could be even if they're living in a memory care community.
Absolutely. Yeah? Okay. Wherever they are. We have wake nurses 24 hours a day. So if the memory care calls and says, hey, we really need you to come out and assess, then that nurse goes and assesses that patient no matter the time of night. And the good thing is, because the goal of hospice is to give them the opportunity to stay where they're at. If it is something like an x-ray or something we can do there, we will do that there. Same with medications. If we think there's a UTI, home health would have to refer you to your doctor to get those medications. Hospice, because we have a medical director, we can have that nurse get that urine specimen and talk to the doctor and go ahead and just order those medications and get them sent to the facility.
I was going to say, am I oversimplifying things when I say that home health is going to try to make things better, whether it's a broken bone or some type of
Condition.
physical condition, and hospice just helps you feel okay?
Yeah, I
That,
think we're trying to create a different quality
yeah,
as far as quantity of the life
yeah,
that we have, and we where our goal is. I hope that you regain some type of strength and feeling in home in hospice, but that isn't the main priority anymore.
exactly.
Okay.
It's comfortability, it's care, it's spending that time with the people you love and feeling good about doing that.
So in that respect, can I look at my mom or my dad's condition, whatever the problem may be, whether it's mom's Alzheimer's or dad fell and broke something, and that's how I can kind of think about, okay, dad's going to get better because he broke his foot,
And we
so
can recover.
and we can recover. So that's home health. Mom has Alzheimer's and it's getting worse and worse and worse. That may be hospice. That's kind of a general idea about it, and then I can call and ask an expert like you.
Yes, absolutely. And I think it's a good way, and I see it a lot in the blog. This is why I feel like it's good to talk about this. I see in a lot of your Facebook group individuals struggling with, we see this huge decline. This is what we're doing with home health, but then we're not seeing, we keep going around in circles. And I want to just shout out, please reach out for there's so much more that can be done. And it's not giving up. And I think that's a big part to say. If you decide to look into hospice, that's not giving up on a loved one, because there are things we still treat, UTI, if there's an infection, we don't want them to get worse.
Right.
We just don't want, we're not going to be doing the big things anymore, like chemo, radiation, or a peg tube to restore them to some type of level.
Yeah.
Can you give us some other examples, again, just for people to be able to relate to, of conditions potentially that you see are often a very good fit for hospice?
Absolutely. I think COPD, so any lung disease, heart failure, congestive heart failure is a big one. Alzheimer's is a really good one to look at. But I also like to talk about those things, the signs that individuals see.
Okay.
If they're starting to fall more, if they're starting not able to do their activities of daily living on their own, if you're seeing weight loss, there's probably, and I think that there's a lot of diagnoses we can talk about, but to look at those signs, and a lot of times that you're seeing things they're not able to do on their own, or they're very confused. That's a good time to at least have that conversation with someone, because there may be diagnoses too that we see that aren't just diagnosed. There's so many different doctors involved with things. You just never know. Maybe there's a piece of puzzle we're not getting.
Yeah.
And then just thinking about home health, again, just to help people understand the difference. Home health might be more in the cases of, for sure, something orthopedic, a broken bone, stroke, maybe even a heart attack, those kinds of things that are almost would it be fair to say it's almost more like an event that happens, or a diagnosis that potentially home health is trying to help you manage and or improve from? And I know you can describe that a little bit too, but just to clarify that a little bit more.
Yeah, absolutely. I think if you have a heart attack and before you were living on your own, I would love to see you go into home health and be able to come back to a different, we're not sure what level you're going to come back to, but I'd love to see you work really hard to come back to some level of functioning that hopefully is independent again. But if not, restore you to some level that you feel strong again. And then if that doesn't happen, or if it's not working in home health, you need more than that, it's a good time to look at hospice. I don't want anybody to also feel that they're being pushed into something that they're not ready for, because I can give in hospice a little bit of physical therapy, but not what they're going to be able to get in home health services.
So yes, sometimes they might be in conjunction, but most of the time it's going to be one serves this purpose and another serves a different purpose.
Yes.
And then just last question is, what are the questions we should be asking if we think our parent might be eligible for hospice? What questions should we be asking as we decide if that's the right fit and or who we might get to help us?
I think the biggest thing is asking how they're going to serve your loved one and the individuals in your life, because it's really hard for families to determine which agency to go with.
Mhm.
And so a big one I always ask is, at what level, what does your staffing level look like?
Mhm.
No matter what agency you choose. I'll just give an example, and this is something we just stand big on with Generations is we have a very low nurse to patient ratio.
Mhm.
My nurses are only seeing 2 to 3 patients a day. If that nurse is seeing 10 patients a day, what does that look like for your loved one? And so asking what the staffing looks like, do you have enough aides to bathe my loved one at the level that is prescribed? How often are you able to bring me my incontinence supplies for my loved one? And how quickly can we access you if we need it? I'll give an example that we obviously a 24-hour care line, but if you call the office, we give you one number for anything you need, and then someone answers that, and a nurse or whoever that right individual is, since there is a team, calls you back, and we keep a record where we can all see who's doing what when. So if they're not able to coordinate your care where everybody's involved at all times, then that's something you need to ask and talk about. Why and how are they able to do that? We talk about every individual twice a day. So 8:30 and 4:30, all of our patients are talked about. And that makes a difference, just because even myself, who may not be there all the time, I know what's going on if someone calls and has a question for me.
Yeah,
asking that of any agency is huge. What are they coordinating, and how do they all talk to each other so that your loved one, the goal here, and especially kind of this post-COVID or whatever we want to call it, they're not getting lost in the mix.
Yeah.
Right.
I think there's a ton of really good options out there, as long as you feel comfortable asking the hard questions. If they aren't giving you what you need, knowing that you do have the ability to ask them for that. And then if they're not giving that, you do have the option to leave them and go somewhere else. I don't want anyone to feel like they're stuck getting a care that isn't right for them or not at the level that really it should be.
Well, I think it's hard to avoid all the confusion, but Jessica, you've helped clear a lot of things up. Thank you so much for all of your expert advice.
Well, thank you guys for having me. I think your group really is bringing a lot of attention to things that really need to be talked about.
Thank you very much.
Yeah, thank you. I think, again, what it all comes down to me, is that know who the experts are and don't be afraid to ask them for what they want, what they think you should do.
Because sometimes the more you know, the more questions you have.
Oh, yeah.
Right?
Yeah.
As you learn more.
It's hard to keep things straight. If you have any other topics you'd like us to discuss, please let us know. Parenting aging parents.